So now I want to talk about embodied experience. And this is probably something that would feel less familiar if you are mostly doing talk therapy, be it cognitive or psychodynamic, and more familiar if your approach is more experiential or body-oriented. But in any case, that you can connect to if you think of the ways that a lot of the way we do what we do, we perceive what we do, we talk about what we do, is related one way or another to some form of experience. So if we talk about, for instance, hands-on experience as an abstract concept, this is really literally hands-on experience. So we talk about get a grip, and this is literally get a grip. So for instance, I mentioned before what happens when a client is very activated, has difficulty containing their emotions, has difficulty self-regulating. In everyday language, we would say get a grip. And literally, embodied experience is to realize that get a grip is not a phrase that could just as easily have been think blue or sit down, but is literally get a grip, because there is an underlying experience that corresponds to what we call get a grip. So having a vehicle to pay attention to what happens physically as clients deal with difficult topics, with their emotions, with their sensations, is a vehicle to actually explore embodied experience. How far into it we go, how deep we go, depends on who we are as a therapist, depends on the client, depends on the session. But even if you're not somebody who regularly pays attention to embodied experience, you might find it interesting to notice these things when you work with clients. And so I mentioned some of them. I mentioned the get a grip part. But for instance, you will notice that, say, a client might be dealing with anger, and you notice that maybe there is something about the squeezing. Maybe the squeezing more. Maybe there is something where it's not just in the squeezing, but as they squeeze, there's something happening in their eyes, there's something happening in the jaw, something happening in the shoulder. And where at that moment, you are really literally dealing with embodied experience. So again, your style of work may be to simply notice it as information for you. It may be to gently draw the client's attention, something like, do you notice what's happening in your body? It could be directing their attention more into, are you noticing what's happening in your shoulder? You may be somebody who likes to give more explicit directions and experiment with it. But whatever form it takes, whether you are simply noticing it for yourself or exploring it further with the client, I think it's helpful to think that at these moments you are dealing, and the client is dealing, with embodied experience. And it is good to know that actually the physicality of having the ball in the hand during that moment is providing a vehicle to make it a little bit more visible in the room, and gives you a gateway to explore it further if you want to, but at the very least to introduce that dimension, that emotions are not abstract things that disembody, if you want. But to be aware of that relationship, to be aware of how connected feelings, sensations, emotions are to actions. And that would be, if just that would be good enough, to justify paying attention to embodied emotion.